We have three major types of diabetes mellitus. We have type 1, type 2, and gestational diabetes. Type 1 is usually, the onset is usually from a young age, and the issue here is defective production of insulin or no insulin at all. So this usually affects the pancreas, where insulin is usually produced. Remember, we use insulin to control the amount of sugar in the blood, and in case you have an issue with that hormone, you are either not going to be able to control your blood sugar in your system, or you'll have to compensate for that. So the best way of compensating for that is just using synthetic insulin, where you'll have to inject yourself with insulin that will help you in bringing down the sugar level to acceptable levels. Now sometimes people usually overdose here, and it's or you find them injecting themselves when they are hungry, and this kind of dangerous in a way, because you're going to go to a state that usually called hypoglycemic state, whereby you're going to have little sugar because a majority of the insulin acted on the available sugar, leaving none to your organs. So to prevent this, you'll have to follow your physician, the instructions, make sure they are very clear and you follow them to the letter. So in type 2, this is more of lifestyle. So you get this diabetes because you've been loading your system with a lot of sugar to a point where the insulin that is usually available for you becomes less effective at doing the same job. So we call that insulin resistance. You usually find out that this usually occur during the late stages in life, mostly 35, 40, 50 years and above. It's very preventable by just making sure that the diet that you're taking will promote you not having that thing. So mostly it's usually very hard to control type 1, but type 2 is very, very controllable. You can be able to prevent that by having the right diet, reducing the amount of sugar intake in your system. So the way you control the sugar, sometimes usually swallow tablets after eating, or maybe when you discover that the blood sugar is high. So yeah, again, I'm not going to show you how to do that. So you just make sure you liaise with your physician on the directions of using this. We have another type which is usually exclusive to pregnant ladies. In case maybe you become pregnant and your blood sugar spikes and stays there, so blood sugar stays just high all the time, you might be having gestational diabetes, because that might be affected by the fact that you're pregnant and the demand for that sugar is high. So you might find yourself having all the system collaborating to increase the amount of sugar in your system, so making you to be exposed into a situation where you're going to have a lot of sugar, and the insulin which is there might start getting the insulin resistance we've talked about in a few minutes. Now for this one, you'll have to again liaise with your health provider to make sure that this sugar is controlled, because most of the cases, people that don't control this sugar at this level, they usually graduate to type 2 diabetes. So it's very essential when you become pregnant, get screening for sugar. We have several types. We have something like OGTT, we have like a random blood sugar, fasting blood sugar. So they are usually good for you to be screened on early in your pregnancy. So I hope this was an informative session. Let's meet in the next video. Make sure you like and subscribe to the channel.